Hello students, welcome back again. So today we are going to discuss one of the fastest growing and in-demand career path after 12th. If you love biology, physics and technology, you are going to love this video. In today's video, we are going to discuss about bachelor's in medical radiology and imaging technology, also known as BMRIT. So when you visit a doctor, before any therapy or surgery, they always ask for some kind of report. It could be X-ray report, MRI, CT scan or ultrasound. And that is why radiology and imaging technology, they are the backbone of modern healthcare. So in this video, we are going to discuss about the demand, the course overview, career scope, jobs, top colleges, and of course salaries. Before I move on, please don't forget to subscribe to our YouTube channel. And if you need any help, feel free to reach out to us. You can also send us a hi on the WhatsApp number given on your screen. So before we move into the details, let's discuss a little bit about the nomenclature. Radiology is equal to radiography is equal to radiodiagnosis. When it comes to the course names, different colleges name it differently. For example, few colleges like AIIMS, they call it BSc in Medical Radiology and Imaging Technology. Whereas if you go to CMC Vellore or CMC Ludhiana, they name it BSc Medical Radiography and Imaging Technology. But don't confuse radiology with radiotherapy, which is absolutely different. So just remember this, radiology is equal to radiography, but radiology is not equal to radiotherapy. Let's move on. So why BMRIT? Why should you pursue BMRIT after class 12? Firstly, if you love biology, physics and technology, definitely you should consider BMRIT after class 12. As discussed a little while ago, it is the backbone of the modern healthcare and medicine. Before any therapy or surgery, you always need to go for an X-ray or CT scan or MRI scan. So there is a need for this. Thirdly, there is a huge shortage of imaging technologists or radiologists. I'll show the reports later in the next slide. And because of the latest technological advancements like AI, again, there are a lot of changes that are going on. In the future, it's going to be the radiologists who can leverage the AI tools. They will be in great demand. So if you want a career path with high demand and job stability, then of course, BMRIT is something you should definitely consider. So as you can see, here are a few reports that shows, that describes about the shortage and crisis. There's an article on Times of India, the Indian practitioner. Currently the stat shows there's only one radiologist or imaging technologist per 1 lakh people. So there's a huge workload. So it's not only demand, it's a career path where there's a huge shortage of trained professionals. Now let's discuss about the BMRIT course overview. It's going to be a 4-year course. In some colleges it could be 3.5, which includes 3 years of academics plus 6 to 12 months of internship. You need to have 50 to 60% in your class 12 with PCB or PCM. Most of the colleges require PCB, but there are a few colleges where you can also get in with PCM combination. Entrance exams, well, from 2026 admission year, NEET is going to be mandatory for a lot of colleges. But apart from NEET, you can also appear for CUET, CUET, or some of the other paramedical entrance exams like AIIMS Paramedical exam. Some of the other colleges have got their own entrance exams, so you can apply for them. Yeah, there are a few private colleges, really the new ones, they can also admit you on the basis of 12 score. But if you want a good college, do prepare for NEET or some of the other top entrance exams for allied and health courses. Here's a brief curriculum or syllabus overview, you can say. No need to, if you want the details, you can just pause your video or you can take a screenshot, you can note them down. In the first year, most of the fundamental courses will be there. So definitely biochemistry, physiology, anatomy. In the second year, you will learn in detail about the physics behind radiology and of course, overview of the different various types of imaging modalities like X-ray, CT scan, etc., etc. But again, the most of the heavier subjects will be taught in the third year, where you will get exposed to MRI, CT, X-ray, etc., etc. Then you will also come across the subjects like nuclear medicine, angiography. Those are going to be very important. And finally, there will be internship. As I said, try to go for the courses which provide a 1-year internship. But again, as I said, some of the reputed and prestigious colleges like CMC Vellore or CMC Ludhiana, they offer 6 months internship, so it's going to be a 3.5 year course. So not a problem. But make sure you attend a good college. Now we'll discuss some of the top colleges. First, you look at the government colleges, and I will show you some of the data like why they are going to be very competitive. Look at AIIMS, they are going to be only 10 to 15 seats. In fact, some of the campuses will have only 5 to 7 seats. Then PGIMER, again only 7 to 16 seats, JIPMER 5 to 8 seats. So any top government college is going to be super competitive. So prepare well. And the advantage of attending a government college, definitely the fee is going to be on the nominal side. Now the range is 5,000 to 60,000 per year. So for 3 years or 4-year course, is not going to cost you a bomb. Now here some of the top private colleges. Of course, CMC, Ludhiana CMC Fellow is one of my favorite. I have many friends from that institute. Then of course SRM, Amity, Sharda. You can find a detailed list on our website. If you need any help, just feel free to email us, or as I said, just send us a hi on WhatsApp on the number given on your screen. At private colleges, there will be more seats, maybe 30 to 60. Some of the private colleges, there might be 100 seats as well. But yeah, tuition fees is going to be on the expensive side. Let's move on. So career options. This is where I really love this field, because it's not only the clinical. There are 3 kind of career options you can have. You can find jobs in the clinical settings. So you can definitely a technologist or radiographer. You'll find options in the corporate and IT field. So understand this. After doing the scan, a radiologist or an imaging technologist, he or she needs to process the images. So a lot of software come into play. A lot of IT and health tech companies hire BMRIT students and graduates for their roles. Obviously, sometimes BSc might not be enough. At the top companies, you might need to do a MSc, but BSc is going to be a good stepping stone. And last but not the least, apart from clinical and corporate roles or IT roles, you'll also find enough options in the research sector or research space as well. One of the hot favorites is going to be the nuclear medicine or nuclear medicine technology. But apart from that, even if you are getting into AI or biomedical engineering, enough number of research opportunities are there in India and abroad. Now something which is going to be very important for a lot of students and aspirants, how is the salary? So if you look at the freshers, you might think, okay, the salary is very modest. But if you look at the graph, with time, there's a sharp increase. And in some of the roles like corporate or IT, the salaries could be even more. So ultimately, BMRIT is going to give you a career which will be future-proof. It has got a solid demand, stable job and career growth, and handsome salaries as well. It's perfect for those students who love science, machines, and patient care. We hope you enjoyed this video. If you have got any queries, just put them on the comment section below. Thank you and good luck.